another episode of ABA Mom. I'm your host, Allie. I'm a board-certified behavior analyst and a mom of 5. And today we're tackling a crucial topic that often comes up in conversation about applied behavior analysis, or ABA. While ABA has been a valuable tool for many, it's important to acknowledge its complex history and criticisms it's faced over the years. We'll discuss how ABA has evolved, some of the harm that has been caused, and more compassionate techniques that can be utilized today. Joining me for important discussion is Tracy Smith, a registered behavior technician and student analyst who has been in the field for 4 years. Tracy is also a mom and a volunteer at Benson's Clubhouse, which is dedicated to advocating and supporting individuals with autism. Tracy, welcome to the show.
Thanks for having me. I appreciate it.
All right, let's start with a bit of history today. ABA was developed in the 1960s, and while it has helped many individuals with autism and other developmental disabilities, it has also faced significant criticism. The early days of ABA were marked by a focused behavior modification that often prioritized compliance over individual needs and feelings. Techniques such as aversive conditioning, which included punishment, were sometimes used in ways that could be harmful. This led to concerns about the emotional and psychological impact on individuals receiving ABA, particularly when they were treated as if their behavior were problems to be eradicated rather than understood. Tracy, what do you feel parents' concerns are and maybe misconceptions with ABA today?
Yeah, kind of from the past, right? Like there's concern that ABA, could cause harm on the child. And that's still kind of pulling in that behavior modification system that is not the foundation of ABA at all. And
I agree.
Probably trying to get away from that stigmatism, that old social concept still kind of sticks around. And that's really not the concept of ABA.
Yeah.
So really teaching, that's why I was so excited to come on, to just learn really what ABA is about. They hear about it, their insurance kind of maybe covers it, but, we have no idea what it is. So,
yeah, I think that's an excellent point. And just to kind of piggyback off what you just said about the insurance too, I think that's an important part too, because it seems that a lot of parents get most of the time it's the autism diagnosis. And then the first thing they do is go, okay, so ABA therapy, speech, OT,
right?
The 3 that they go to.
Right.
Without a whole lot of knowledge on what ABA is.
Right. That's your next direction. Go there.
Exactly.
And know what it's going to tell you what it's going to do, but go there.
Right, exactly. Without any explanation at all. And, I think too, today we're living in this cancel culture, right? So it's just like, ABA is bad, ABA is abusive. And I think at some level, just, the evolution of ABA, like today, if we were still doing some of those same strategies that, behavior modification and those working and focusing on punishment, that would be considered abusive for sure. But thankfully, that's not what we're doing.
Right. I can't remember our little, our ABA guy, but he wrote a lot about coercion. His name is not on my head right now. That's what society is. That's what behavior modification was. And, we make threats. We do strong things. We're going to take something away. We're going to be aversive to make you behave. And that is the opposite of what ABA is about.
Exactly. And that's what we hear too, or like that compliance piece too. Also, it's crucial to recognize the field has evolved significantly, but ethic is a huge part of our field. How do you think that the ethics code, because we have to abide by an ethics code, that has changed ABA?
Yeah, so like the board's changed ethics code to a couple different things throughout the ABA board. So the board, the certifying board for ABA has changed the ethics code a couple times of how it's going to be kind of rule-based. It's a general guidelines. So along with kind of society change and how ABA, how they want it perceived and to be done. I can't think of my word there, but
that's okay.
It's so you do want to be ethical. You do want to, so the core principles are, benefit the person that you're treating, have some integrity, show your competence in what you know,
right?
So I think those are just great examples of how to be ethical and to treat your clients and their families, which also, families or other people are called stakeholders, who's involved.
Right. Exactly. Because they're all our clients. Those are all, and that's one thing that you're, taught in school, but also part of our ethics and having like that dual relationship too. It's like your client is not just, the kiddo you're seeing, or if you work with adults, but it's also the families you work with too. So that's really important. And, those stakeholders that are involved with the kids, those are also, it's important to, even though you're treating like the direct client, there's like these people are essential to their environment. And it's important that, and it's not in our ethics code, but it's something that we've really been doing a lot in our field. A lot more is that compassionate care. So just having more compassion towards our clients and their families too, which is something I think that, the early days of ABA was kind of lacking because we were based on the science approach, right? So just that seeing people as people, which I it's a great thing. We want to be able to do that.
Yeah, because the 60s we were if anything was different, you weren't at home being treated, so
Right.
when you're in a different facility, maybe it was you could have a different take on it, but now we are in the community, we are at home, we are everywhere, that it's to be treated and compassionate of where they're at, where they're at, and where we can help grow them. Everybody's kind of responsible.
Yeah, and I like that you said that too about the facilities, because that was something I wasn't even thinking about. Is that they were treated more as like a patient, like almost
right.
Versus like I think client is more appropriate term now. And also,
client is kind of you serve them, like, right, like they employ you, like that,
right.
And as a patient, you're almost,
right.
It's a different relationship. So
I agree. I think that was a really great point to make too. There's also been that greater emphasis on the ethical practice. We do have we have the code of ethics and a more holistic approach to treatment. Many practitioners now prioritize individuals' dignity, preferences, quality of life, instead of purely focusing on compliance. So that was a big thing at the beginning of our field, is focusing on just the compliance piece. There's a shift towards teaching skills that enhance communication, social interaction, emotional regulation, techniques such as positive behavior supports, or PBS, natural language acquisition, NLA, are examples of more compassionate approaches that focus on understanding the reasons behind behavior rather than just modifying them. There's a real push towards person-centered approaches in ABA. And one thing I think we kind of talked about before that I just wanted to bring up was that, those stereotypies that clients have, like the hand flapping,
make the stemming noise.
Yeah.
Talking to it. Mm-hmm. Yeah.
And I know we've really called it, like in our field, I think we say, stimming, or we'll say, stereotypies, but, I think that the way that we kind of look at it as whether or not we want to gain compliance, so to speak, is it affecting their overall life? How is this affecting their quality of life? If it is not, in fact, does it not have any impact on their quality of life, then we should just leave it alone. I mean, that's kind of,
right. If you get excited or, we do this, yes, it might have people looking, but it's then a moment to teach.
Exactly.
Instead of saying, you could just be like, it's okay. They're happy, and then teach others, like, it's okay. I had a parent that said, when my son does it, my dad does it right with them, and maybe we should do that more. And I was kind of like,
I love that.
I like that.
Yeah, that the dad did it too.
Awesome. Really harming them, anybody else? No.
Right.
So it's not something that needs to, because you would do probably a behavior modification, and then it would become aversive because their body is doing this as a response and to something that they like, usually. And so to stop them from doing it would cause that person to have a lot of adversive, like they would not want to be around that person. It would cause, other,
Right.
so, yeah, so it's okay. It's like, let's take the time to be like, they're okay, they're happy. Like it's, you can
More like we as a society should just be more accepting to it. But I've heard, from the autism community that it physically hurts them sometimes not to let that stimulation out.
correct. Right.
Just hand flapping. Like I just need to flap my hands. Like I need to let it out. And I do this thing, and my husband makes fun of me because like when I get excited, I kind of like put my hands like this, and I go, and I do it all the time, but like it feels good to do it. Like and then sometimes like I think because as a kid it was kind of embarrassing, so sometimes I'll do it under the table without realizing it.
Yeah, my family
Out. Yeah.
like this holding.
Yeah.
Yeah, I do a little bit more indiscretionary
Exactly.
squeezing, Uh-huh.
Because that's what we were taught. Like, okay, like what are you doing? Slapping your hands around. Like, what do you need to put your hands away?
Yeah,
You should just accept it. Yeah.
Right.
And as it changes, like I've had also kiddos that it affects them, like, brushing, they do it so much. Like now we're not like brushing our teeth, or now we're not like things that are really important for them to be able to do it. Wait, you intervene, but what we try to do is find some kind of replacement so they can still get that out, but it would be more perfect. Maybe like if they have all this hand flapping, maybe like a vibrating toothbrush, like still get that stimulation in their hands. But yeah, I think I see all the time. I love that dad did that. I think that's awesome.
Yeah. Yeah. Right.
I know. Cool.
I know.
More of that.
And it took me a second. Like, should they? Yes, I like that.
Yeah, me too. I've never heard of a parent doing that, but I love it. I love that they do it with, and I think too, I've had parents that they go to like, they don't want to go out to the park or something like that. I mean, a lot of times it's because of, meltdowns or SIBs or little park, but sometimes it's just that stereotypy. And it's like, okay, like I don't want to bring them to the park because they're just going to flap around the whole time. So I think we just need to, start making that normal, just normalizing hand flapping and, other stereotypies that they do.
Yes. Shaking the hand. It stems from a visual. They like the visual because they're happy, that they're maybe a little overstimulated, but it's very more natural that their body needs to do these things. I mean, we don't be like, some people do, but if, this is okay. But why? Like it's
exactly, we've accepted it.
Distracting, but this is distracting.
Yeah, I agree.
Nails, they're all along the same lines. So
I agree. Like we do it all the time. And we're like, what's acceptable and not acceptable? We really need to change that. Yeah. It's definitely something we could look at. Also, parents, I think an important thing is to look at your practitioners. You want to make sure they're certified by the board. So, for example, Tracy, you're an RBT, going to be a BCBA, hopefully soon. And then, I'm a BCBA, and we're registered at the board. So we do have that specific training and also the ethics code. So, there are behavior assistants, there's, other therapists out there, but I think that because we hold such strong ethic practices that your like parents are just mindful of, who they have as their therapists and, kind of look into the certification. I mean, you can even, parents need to look it up them, online, like it's public to everyone to, certification, make sure it's up to date. I think that's important too. And then also just giving parents should feel empowered to discuss their child's preferences and needs openly during the ABA program. Focuses on enhancing their child's overall well-being rather than other techniques. And I find it particularly effective is incorporating naturalistic teaching strategies, or we call it NET, which focuses on learning through play or meaningful interactions. So just like in their everyday life, just kind of doing ABA and every day. That's one thing I love about ABA is that we just can do it in any environment, wherever they are. And this allows child to develop communication, social skills, functional communication, and also the functional communication helps them to express their needs and feelings in a way that can reduce frustration, challenging behaviors, These approaches not only respect the child's voice, but also build functional skills that improves their quality of life. And it's really refreshing to hear these positive changes in ABA. As we kind of wrap up like our message today, what message would you like to leave our listeners regarding the future of ABA and its role supporting individuals with autism?
So like I would like to mention, that ABA is about positive reinforcement. And hey, it's not just good job. It's noticing when your kid does that thing over and over again and you take it for granted. That is something that you observe, that you say, like, I like that you did that. Like,
yeah,
so it's that high five. It's what, do something. Like, I think that ABA, because yes, that kid does that thing we do not like a lot. That's why we're seeking the service, but they actually do good things. And that's what ABA is about noticing the good things that they do. And we're going to help you teach them the other things that can be really good, that will, reduce that thing that we don't want. And we're going to do it ethically, we're going to do it compassionately, and we're going to maybe do it in a different way that makes sense and allows them to complete tasks or do, so put it all together, right? But I really like, and I think it's different. And I think that's one of the things, so maybe another episode, but,
I think that could be a whole other
something good. And we really have to notice it. And not all the time, but notice that they are doing it and it's good.
Yeah.
So
no, that's so important. And that reinforcement is so important. And that's really where ABA comes from. We're really coming from we want to implement those positive behaviors and pull from their strengths, and then also teach new skills for those areas that they are kind of lacking in. So we really try to steer clear of those punishment procedures and things that are aversive to clients. Like, we really want to pull from a positive place. So I think definitely an excellent point too.
And so one thing is, because if we hand flap, and I don't mean to, and that's not the one thing, but
no, but it's an important one. It's a big one,
right? Stemming kind of behavior, unless it's really causing harm, we don't want to get rid of it, and we're going to embrace it. And I just totally where I was going to summarize all that. So
you got it. It's okay. I do that too. I lose my train of thought all the time. That's okay. Go for it.
So yeah, like that's one of the things. It's kind of advocating for them. You have an important role as a community member and stuff like that to advocate for them. That's okay, and you can educate people that it's okay. And if you want to be that other person that goes along with them, doing whatever, it's okay.
Yeah, absolutely. So thank you, Tracy, for sharing. It's been incredibly enlightening, and thank you for all the listeners for tuning into episode of ADA Mom. If you found this discussion helpful, please subscribe and share this episode with other parents, caregivers, or anyone interested in the field of ADA. Let's continue to advocate for compassionate and effective practices in ADA. Before we officially end today's episode, I want to take a moment to reflect on some key points discussed with Tracy. So one of the most striking aspects of our conversation was acknowledgement of ABA's historical shortcomings. It's essential to recognize that while ABA has helped many, it has also been implemented ethically or compassionately. As parents, being aware of this history empowers us to advocate for our children effectively. This shift towards person-centered approaches is a promising sign for the future of the field. I encourage all of you to stay informed and engage in discussions about the methods your child is receiving. Remember, you have a voice in their treatment, and your insights as a parent are invaluable. Thank you again for joining us today. If you have any thoughts or feedback, don't hesitate to reach out. We love hearing from you. Until next time, take care of yourself and your families. All right. Thank you so much.
Thank you for having me.